I have a significant family history of breast cancer. I knew at some point in my life I would be diagnosed with breast cancer. Of course, you always hope it's later in life instead of earlier in life. Andrea Nason, who was my nurse navigator at UPMC Hammett, recommended that I go through genetic testings for the BRCA gene.
Genetic counseling is offered to high-risk patients, so patients who have a family history of breast cancer. So whenever we see that in a patient's history, we always offer genetic counseling for the patient.
Dr. Chan called me to give me biopsy results, and I could tell from the inflection in his voice how hard it was for him to deliver that news. And it made me feel very much like a person and not just a case.
I think in the case of Dawn, with us having the latest and greatest technology in breast imaging, we're able to detect things so much smaller and so much better than we ever have before. And that really makes a significant impact on her prognosis, as well as the type of surgery that she has. By detecting cancers early, she can just have a lumpectomy with the rest of her breast preserved. And whereas before, if we detected cancers much later and they were actually quite large and palpable, these patients would have to have a mastectomy and their breast would be gone.
The genetics counselor, along with the surgeon, helped me determine that I could take a course of action that would be right for me without being so dramatic.
With mammography, we've always struggled with identifying very small cancers in very dense breast tissue. Well, here at UPMC Hammett, we have the latest technology in breast imaging. But tomosynthesis helps us get around that by allowing us to see through that tissue. So it really greatly improves our accuracy in detecting cancers early. And whenever we detect cancers early and detect them small, it means a better prognosis for our patients. We'll be the only hospital in the entire county of Erie to have it, so that patients here, they don't have to go to Pittsburgh, they don't have to go to Cleveland to get this technology.
Every woman deserves the best treatment, the best care, the best testing in their own neighborhood. I feel great, and I have a great future ahead of me. I feel healthy, I feel happy, optimistic that this is never coming back. I've had my one and only battle. I can look at my husband and see how he survived cancer and know that I can do it too. We're not waiting to live our life. We're living it every day and making the most of it every day. And we love each other more and more every day.